Hartley, can you tell us about the Maxiclear range?
Yeah, what happened originally with that is that most companies combined pseudoephedrine. Now, pseudoephedrine caused a lot of problems as well, because what happened is people converted that to methamphetamine. So we wanted to avoid pseudoephedrine, so effectively we combined phenylephrine with various components. What we found is when you combine paracetamol and phenylephrine, in fact, surprisingly, there was an unknown drug interaction between the two of them, and about 2 to 4 times the amount of phenylephrine actually gets absorbed when it's given with paracetamol. That's something that wasn't known, and certainly was a big surprise. We got those results published in the New England Journal of Medicine, which is the world's best medical journal. What we've done is we've taken those and we've redesigned it. So now we've got a combination that basically, instead of having the additional phenylephrine, it gives you the correct amount that you should be getting.
So when you say correct amount, this is really what the regulators assumed people were getting, that that was the limit, but in fact they were getting effectively twice that.
Yeah, at least twice. Yeah, exactly.
So the product that is going to be launched essentially around the world is the product with the correct formulation.
Yeah, correct. Yeah, we've corrected the mistake or corrected the unknown drug interaction and got back to what it should have been, yeah.
Are you surprised that the regulators weren't aware of that?
Yeah, look, it was pretty surprising when we first got the results. I guess it was something we weren't expecting. In fact, we did a further 3 studies in addition to the first one just to check absolutely the results were correct. But yeah, no, it's definitely the case.
I mean, these are sort of everyday ingredients in this category of product.
Yeah, yeah.
But there was really a significant unknown effect of combining those together.
Yeah, no, true. So, I mean, there have been some problems reported since. There was a publication in the United States where a 50-something-year-old lady took the combination and had intercerebral hemorrhage. So, you know, look, it's a sort of thing that in a select group of patients could be a problem, and that's obviously a concern.
In terms of codeine, are you surprised that the regulators still allow codeine to be as part of these combination analgesics?
Yeah, it's something that's been restricted or becoming more restricted over time. Like, for example, a few years ago, the pharmaceutical companies were allowed to advertise codeine combinations, and then that's been stopped. Generally, they were able to sell larger pack sizes, and that's been stopped. So now you're only allowed to buy a pack size with enough for 3 days treatment. So gradually they've been tightening the restrictions more and more. But I guess it begs the question about when is enough enough? Like, are these the right products for people to be able to wander into a pharmacy shop and just buy without a prescription? And certainly that's something that's been seriously looked at right now, where the question now is really, should these be prescription medicines? Are they really suitable as an over-the-counter medicine?
And some of the regulators have moved on codeine-based products for under 12s recently, but this is something that is more a population-wide issue now that regulators are having to consider, aren't they?
Yeah, look, there's different cases depending on the ages. In the younger patients, there's a danger when some patients actually metabolise it too fast, and that has been causes some deaths overseas. Yeah, so it is quite a tricky drug, codeine. Like, it's not that suitable for a whole population because some people metabolise it quickly and other people actually don't metabolise it at all. So 10 or 20% of patients don't metabolise it. So in fact, the codeine in that case adds nothing extra.
What do you think of the idea that pharmacists can tell if somebody has got an addiction problem? They come into the store, they have purchase a codeine-based combination. I mean, do you think pharmacists can really tell? Yeah,
I think it's difficult, and the challenge is actually the sort of people that get affected by these drugs are people that, you know, are people with good jobs, they don't look like a drug addict or what we think a drug addict looks like. And there's been cases in the newspapers, you know, there's been people that have been professionals, they've been in their 30s, they dress in a beautiful suit. I mean, who can tell? And yet these people have been going around multiple pharmacies, buying a pack here, a pack there. It's really very, very difficult to tell, and that's the challenge for it.
And interesting, because I suspect a lot of those people who start out, they have a prescription for this particular codeine-based painkiller, if they've had an accident or something like that. Do you think people understand the risks of dependence that can come with a product that you can just walk into a pharmacist and buy?
Yeah, look, I think that that's definitely a real problem. There is an assumption, and actually there's a need for drugs that are available over the counter to be pretty safe. They're suitable to be used without prescription, without a doctor being involved. And something like codeine, that's certainly the challenge, because the fact it is available over the counter, people would assume that it's pretty safe, it surely can't cause these type of problems. So that probably adds to it, yeah.